So I'm here to bring you another video, and in this video we're going to be talking about 3 things that definitely do not work for hair growth, right? So these are things that I like to say have the best PR agents in all of hair loss, right? Because these are very popular theories that have really repeatedly been debunked, but I wanted to discuss them here again today. So the first offender, if we want to call it that, is biotin. So I would say, honestly, almost every single patient that comes to my office is either on biotin at the time that I see them, or they have tried biotin. And unfortunately, biotin does not work for hair growth. So there actually have been several studies on the use of biotin, and biotin hasn't been shown to improve any hair characteristic. The reason that people think about biotin when it comes to hair growth is because when babies are born with a deficiency in biotin, they're not able to process biotin, they have hair and nail abnormalities. So this is a complete absence of biotin. Then we know that they have hair and nail deficiencies. But for normal people, it's actually very rare to have a very significant biotin deficiency unless you have this genetic condition that would have been identified at birth. Now, the thing that can be confusing is that biotin can actually be quite helpful for the nails. So it actually can make the nails feel a little bit stronger, but again, they don't do much for the hair. Now, that wouldn't be too much of an issue if there weren't actual downsides to the use of biotin. So one, biotin in high doses can actually flare up your acne. And so if you've been taking biotin supplements and you notice that you're breaking out more, then that could be the cause. Additionally, the FDA has put out a warning against the use of biotin because it can affect your blood work. And not just any blood work, but some blood work that can be really critical to determining what type of life-saving measures you may need during an emergency. For example, there was a patient who came to the emergency room with chest pain, and when they were suspecting a heart attack, but they checked a lab called a troponin level, it seemed to be normal. When in actuality, her troponin level was likely elevated, indicating that she was experiencing a heart attack, but because she was on supplemental biotin, this lab work or this true level was masked. And that was one of the reasons that the FDA put out a warning against biotin. So if you feel like you're struggling with hair loss and you just want to figure out what you can do, then I would recommend taking a look at one of my other videos where I talk about things that can be helpful for hair growth, but I would also ask you to stop the biotin. This is not going to be the make or break for your hair loss journey. The second offender that I want to talk about is the use of prenatal vitamins for hair growth. Fortunately, taking prenatal vitamins doesn't have much of a downside, and it's super important if you are thinking about conceiving sometime within the next year, or certainly if you are pregnant. But a lot of women believe that taking prenatal vitamins, even if you are nowhere near, having a baby, you don't have any plans for it, can lead to hair growth, and that's just not true. And the reason people commonly make this mistake is because during pregnancy, many women experience much thicker hair that grows longer, it's fuller, it's shinier, and so they will attribute those changes to prenatal vitamins when in fact, all of those hair changes are a result of the unique set of hormones that are present in high levels during pregnancy. And as many women who are pregnant will notice, if you have really, really luscious, full, glowing hair when you're pregnant, it's also a sign that you are very likely to shed that hair after your baby is born, and that is a process called telogen effluvium. Basically, all of those hairs that are growing longer and no longer shedding during pregnancy all decide to shed at once over a 3-month period after your baby is born. So again, no downside to prenatal vitamins, but it's not going to lead to any measurable difference in your hair. And lastly, I wanted to talk about this old wives' tale. It doesn't necessarily get as much attention as prenatal vitamins or biotin, but I do hear about it occasionally, and that is inverting your hair or kind of turning your head upside down to stimulate hair growth. And so I do want to put this out there as a physician. I do not want my patients to pass out or to get lightheaded because they are inverting their scalp every day. But doing that type of exercise will not lead to hair growth. Certainly, there's something to be said about stimulating blood flow, but if you're looking to do that, you may be better off massaging your scalp. The data on scalp massaging is really mixed, but certainly will not hurt in the way that inverting your head for several minutes or an hour at a time could do. So hopefully this is at least a little bit interesting for you. If you have any questions or you have any other suggestions of tips that you've heard of that may or may not work, I'm happy to hear about them in the question box below. Have a great day.